Ladies, what if I told you that one hormone could be quietly sabotaging your weight, your mood, your skin, and even your reproductive health right now? And here's the scary part. You might not even realize it's happening until the damage is already done. Today we're diving deep into the hidden epidemic that's affecting millions of women worldwide, and by the end of this video you'll know exactly what warning signs to watch for and what steps to take to protect your health. Before we jump in, I need to be crystal clear about something. I'm not a medical professional. Everything I'm sharing today is purely educational based on research and expert sources. If you recognize any of these symptoms in yourself, please consult with your doctor or a qualified healthcare provider for proper diagnosis and treatment. Your health is too important to leave to chance. So what exactly am I talking about? We're discussing elevated cortisol levels, specifically how they show up differently in women and why this matters more than you might think. Cortisol isn't inherently bad. It's actually essential for life. Your adrenal glands produce this powerful hormone to help regulate your metabolism, support your immune system, and manage your body's stress response. But here's where things get dangerous. When cortisol levels stay chronically elevated, your body essentially stays in permanent stress mode, and that's when serious health problems begin. Women face unique challenges when it comes to cortisol because our hormones are constantly fluctuating throughout our lives. Pregnancy, menopause, birth control pills, hormone replacement therapy, all of these can make us more vulnerable to the damaging effects of excess cortisol. And here's what makes this particularly insidious. The early signs are often subtle and easy to dismiss as normal parts of being a busy woman. Let's start with the physical changes that might be your body's first cry for help. The most obvious sign many women notice is unexplained weight gain that seems to defy all logic. You're eating the same foods, doing the same workouts, but suddenly, your clothes are getting tighter. This isn't just any weight gain though. Excess cortisol causes your body to redistribute fat in very specific ways. You might notice your midsection expanding even if you've always had a flat stomach. Your face might become rounder and puffier. Doctors call this moon face. You might develop what's known as a buffalo hump, which is a collection of fat between your shoulder blades. But weight changes are just the beginning. High cortisol can wreak havoc on your skin in ways that might surprise you. You might notice purple stretch marks appearing on your abdomen, thighs, or arms, and these aren't the typical stretch marks from weight changes. These are wider, darker, and more prominent. Your skin might become thin and fragile, bruising easily from minor bumps that never bothered you before. You might develop acne or notice that cuts and bruises take forever to heal. Your hair tells a story too. Many women with elevated cortisol experience hair thinning or loss, particularly around the hairline and crown. On the flip side, you might notice excess hair growth in places you don't want it, your face, chest, or back. This happens because cortisol can disrupt other hormones, including those that regulate hair growth patterns. Sleep becomes another casualty. You might find yourself lying awake at 3 in the morning, mind racing, unable to turn off the mental chatter. Or maybe you fall asleep fine, but wake up multiple times throughout the night, never feeling truly rested. High cortisol disrupts your natural sleep-wake cycle, and poor sleep creates more stress, which produces more cortisol. It's a vicious cycle that can be incredibly difficult to break. Your muscles and bones aren't immune either. You might notice weakness that you can't explain. Tasks that used to be easy now leave you feeling drained. Your bones might become more fragile, increasing your risk of fractures. Some women develop a distinctive rounding of the upper back, sometimes called a dowager's hump. Now let's talk about what's happening in your head and heart, because elevated cortisol doesn't just affect your physical body. The psychological and emotional symptoms can be just as debilitating and often more confusing because they are invisible to others. Anxiety might become your constant companion. Not just worry about specific situations, but a pervasive sense of dread or unease that follows you throughout your day. You might feel like you're always waiting for the other shoe to drop, even when things are going well. This isn't weakness or overthinking, it's your brain responding to chronically elevated stress hormones. Depression can creep in too, often in ways that don't match the typical picture we think of. You might still function normally on the outside while feeling empty or hopeless on the inside. Mood swings can become intense and unpredictable. You might snap at loved ones over minor issues, then feel terrible about it afterward. The emotional regulation that used to come naturally becomes increasingly difficult. Concentration and memory problems are incredibly common but often overlooked. You might find yourself reading the same paragraph multiple times, forgetting appointments you never used to miss. or struggling to focus during conversations. Many women describe feeling like they're living in a mental fog that they can't shake. The reproductive system takes a major hit when cortisol levels are chronically elevated. Your menstrual cycle might become irregular or stop completely. This happens because cortisol interferes with the delicate balance of reproductive hormones. You might experience a dramatic drop in libido, not just disinterest, but a complete absence of sexual desire. Fertility can be affected too, making it difficult to conceive even when you're actively trying. For women going through menopause, elevated cortisol can make an already challenging transition even more difficult. Hot flashes might become more intense, mood swings more severe, and weight gain more stubborn. The combination of changing reproductive hormones and excess cortisol creates a perfect storm for feeling completely out of control in your own body. So what causes cortisol levels to spike and stay elevated? Sometimes it's due to a tumor on the adrenal glands or pituitary gland. Conditions like Cushing's syndrome require immediate medical attention. But often, it's the result of chronic stress that your body simply can't handle anymore. Work pressure, relationship stress, financial worries, caregiving responsibilities. When these stressors pile up without adequate recovery time, your adrenal glands stay in overdrive. Certain medications can also elevate cortisol levels, particularly corticosteroid drugs used to treat conditions like asthma, arthritis, or autoimmune disorders. If you're taking these medications long-term, it's crucial to work with your doctor to monitor your cortisol levels and manage any side effects. Here's something that might shock you. Many women suffer with these symptoms for years before getting proper diagnosis and treatment. The symptoms are often dismissed as normal parts of aging, stress, or just being a busy woman. Healthcare providers might treat individual symptoms without looking at the bigger picture. You might be prescribed antidepressants for mood changes, sleep aids for insomnia, or diet programs for weight gain without anyone connecting the dots to elevated cortisol. If you're recognizing yourself in these symptoms, the first step is proper testing. This usually involves measuring cortisol levels at different times of day, since cortisol naturally fluctuates. Your doctor might order a 24-hour urine test, multiple saliva tests, or a dexamethasone suppression test. These tests need to be interpreted by someone who understands cortisol patterns and can distinguish between normal stress responses and pathological elevation. Treatment depends entirely on what's causing the elevated cortisol. If there's a tumor involved, surgery might be necessary to remove it. If it's medication-related, your doctor might adjust dosages or switch to alternatives. For stress-related elevation, treatment often involves a combination of stress management techniques, lifestyle changes, and sometimes medications to help regulate cortisol production. The good news is that with proper diagnosis and treatment, many of the effects of elevated cortisol can be reversed. Weight can normalize, mood can stabilize, sleep can improve, and energy can return. But it takes time. Your body needs months or even years to fully recover from chronic cortisol elevation. Prevention is always better than treatment, and there are steps every woman can take to support healthy cortisol levels. Regular exercise is crucial, but not excessive high-intensity workouts that can actually increase cortisol. Think yoga, walking, swimming, or moderate strength training. Sleep hygiene becomes non-negotiable. Aim for 7 to 9 hours of quality sleep each night, and try to maintain consistent sleep and wake times. Stress management isn't just a nice-to-have, it's essential for cortisol regulation. This might mean meditation, journaling, therapy, setting boundaries at work, or saying no to commitments that drain your energy. Nutrition plays a role too. A balanced diet with adequate protein, healthy fats, and complex carbohydrates helps support stable blood sugar and cortisol levels. Building strong social connections and having outlets for relaxation and joy aren't luxuries. They're necessities for long-term health. Your body needs regular signals that you're safe and not under threat, and these activities help provide those signals. Here's what I want you to remember. Your symptoms are real, your concerns are valid, and you deserve to feel healthy and vibrant in your own body. If you're experiencing multiple symptoms we've discussed today, especially if they're affecting your quality of life, don't let anyone dismiss them as normal or inevitable. You know your body better than anyone else, and persistent changes deserve investigation. Keep a symptom diary for a few weeks, noting patterns and severity. This information will be invaluable when you speak with healthcare providers. Don't be afraid to advocate for yourself or seek second opinions if you feel your concerns aren't being taken seriously. The right healthcare provider will listen to your experience and work with you to get to the bottom of what's happening. Remember, I'm not a medical professional, and this information is purely educational. Every woman's situation is unique, and what works for one person might not work for another. Always consult with qualified healthcare providers for personalized advice and treatment plans. Your health is your most valuable asset, and investing in understanding your body and its signals is one of the best investments you can make. If this video helped you connect some dots or gave you information you needed, please give it a thumbs up and share it with other women who might benefit. And subscribe for more content about women's health topics that often don't get the attention they deserve. Take care of yourself, trust your instincts about your body, and remember that seeking help is a sign of strength, not weakness. Your future self will thank you for taking action today.